One company that declared numbers went up about 5% yesterday, followed up with good gains of about 2% today, as well as Fortis Healthcare. Let's welcome in the management at Fortis Healthcare. Mr. Singh, CEO at Fortis Healthcare, is now joining us. Sir, if you could just tell us about the quarter and especially post demonetization, how have things changed at Fortis Healthcare?
So I'm very pleased to report that that Fortis Healthcare had a very solid quarter and a busy quarter, and I'll explain why. As you're aware, obviously, demonetization is the buzzword for everybody in India today. And demonetization hit in early November, and like anybody else, like any other industry in India, we were certainly impacted. Having said that, we're reporting very solid results. Our SRL pathology business has grown by over 10%. Our hospital business has grown by almost 9%. And keeping in mind, for the hospital business, this is same number of beds, so we haven't added beds. This is like-for-like beds. And so having almost 9% revenue growth is a very good indicator, and we're certainly pleased with that. Our on the bottom line, our EBITDA has grown by 8%. Our EBITDA has grown sevenfold at Fortis, and certainly a good performance and a good indicator. Similarly with SRL, our margin is over 20%, and good solid performance across the board. So there was, and there continues to be to some extent, an impact from demonetization. I think it's been a bit of a challenge, I think, for all of us, whether it's you or me or anybody else. I think we've all had some challenges around the change in how we live our lives. And what we've tried to do at Fortis, quite honestly, the first thing we decided immediately was that no matter what happened, we would not turn away any patient, and we didn't. And we're very proud of that. The day demonetization hit, we established free internal medicine OPDs in every one of our hospitals to make sure that we did not turn away even one patient, because ultimately we are committed to providing great patient care. At the same time, we've also adjusted the way we do business. We've added multiple payment platforms. So again, as most of us do, much of our lives we live through cash. We've expanded our payment platforms. While we always took credit cards, debit cards, we're taking checks. We've signed up with the Paytms and the MobiQuicks and the Pays apps of the world. Everything you can do. If there's a payment platform out there, we want to make it available. We have people in our hospitals explaining how these payment platforms work so people can sign up. So quite honestly, it's been a bit of a, listen, at the end of the day, while we think demonetization is good for the country, it's been a painful transition for many. We're trying to simplify it. We're trying to make it as easy as possible and help our employees, our doctors, our nurses, but most importantly, our patients continue to make sure they get the best possible care. I think the other piece that's happened in the first quarter, in the third quarter here, that's probably worth mentioning, because there's an impact in our bottom line, is you'll recall that Fortis Healthcare purchased 51% of FHTL from RHT. The 51% had an impact on our P&L, I'll explain in a couple of different ways. So 30% of RHT is owned by us. So we own 30% of RHT. When we purchased 51%, there was a price appreciation in that 51%, and 30% of the appreciation came to us on the bottom line. In addition, the 49% that remained was revalued, and there was growth there based on the 51% sale price, and 30% of that growth in value came to us as well, which is why we have this a very nice looking bottom line. In addition to good business performance, good business results, this has certainly helped us, but it's a non-cash increment on the P&L. But again, I'd still like it on our P&L versus somebody else's. So I think net demonetization, lots of stuff happening. Very pleased with where we are. Our doctors continue to provide great patient care. We continue to expand our medical specialties, and we believe we're moving forward in the right direction. So good solid quarter, lots more to do, but certainly we feel good about where we are, and think we'll show more of the same going forward.
So can you also just tell us about the hospital business, where the margins grew, or rather EBITDA grew by 7 times, which you also mentioned in your earlier answer? What has changed over there?
Well, there is, the FHTL piece has certainly had a little bit of an impact on our EBITDA number, certainly. But I think that the more important question is, you rightly asked, is what's happening inside the hospital business. So 2, 3 things. One is, as I just alluded to, is we've continued to, we believe we have the best doctors in the world, best doctors in India, best doctors in the world working with us. And we're very, very proud of working with our doctors and what they do. And quite honestly, I think our doctors are doing some just tremendous work. We are the leading cardiac transplant center in the country by far, between what we're doing in Chennai and what we're doing in Bombay. Liver transplants, we had a fantastic month in the month of January. We broke a record here. We continue to do a lot of work in the cardiac space. When you look at some of the new things that are happening, whether it's transplants I just alluded to, whether it's TAVIs, LVADs, neurosciences, we have a fantastic medical program. We've added 2 robots, one in Gurgaon and one in the Fortis Escort Heart Institute. And we're doing some tremendous work there, some great procedures and lots of satisfied patients. So I think on the clinical side, we've continued to invest in medical technology. We brought on some new doctors who are doing some great things for us. At the same time, we've looked at our operation. We have something called a Fortis operating system where we track almost 200 patient-facing activities. And we rank our hospitals, we rank the activities, and we're doing very, very well there. And then finally, I think from an efficiency perspective, we're trying to be a bit more responsible when it comes to cost management. So I think when you add all of that up with a tremendous focus on patient care, because ultimately that's what we're here for, that's what every one of us, including me, our number one job is to do, either take care of a patient or support someone who does take care of a patient. And I think all of this is adding up. I think it's becoming a good story. We've been talking now for the last year and a half about the fact that our focus on patient care with good systems, good process, great doctors, great nurses would lead us and move us forward. And I think that's exactly what's starting to happen. And there is a demonetization impact. We'll probably see more of that, a little bit more of that going forward. But I think as we move forward and as the further we get removed from it, I think the numbers will get stronger. And I think we will continue to move forward in the direction of becoming the very, very best healthcare provider in India today.
So you were taking some initiatives as far as the entire capex is concerned, entire margin focus is concerned about 1.5 years back, and I remember talking to you about it. Do you think that has started to pay off?
Yeah, very much so. I think the from a management perspective, from a leadership perspective, whether it's our Fortis Medical Council, which are some of our top doctors, whether it's the administration, which I'm a part of, I think that the initiatives we've had, whether it's been around medical technology, whether it's around new equipment, whether it's about new medical programs, exactly what you just alluded to, we've looked at efficiencies in our system. I'm pleased to report that I think we're very much on track. We articulated a plan which you've alluded to. It was around clinical excellence. We said that we would start publishing clinical outcomes, and 7 months ago we started doing just that. We started with 1 hospital, now we've added a 2nd hospital. I think by the time Q2 comes around, we'll have 4 or 5 hospitals and 3 or 4 medical specialties where we're publishing clinical outcomes. So I think that we are, whatever is happening at Fortis is very much happening by plan. I think there's a lot more to do. Unfortunately, the disease burden in India is such that cardiac disease isn't going anywhere. Unfortunately, cancer, India is diagnosing hundreds of thousands of patients with new cancer patients every month. We continue to be the diabetes capital of the world. So the disease burden is a challenge, and in all likelihood will continue to be a challenge. So we're very much on plan. We're very much focused on the direction of patient care. Listen, at the end of the day, that's the biggest thing we focus on. That's what we talk about all day long. How do we take care of patients? How do we do it systematically? How do we do it predictably with process? And how do we do it with empathy? And so to answer your question, very much on track, very much as per the plan, and encourage as we go forward.
Right. As far as diagnostic business is concerned, we saw Dr. Lal's numbers, and Dr. Lal Path Lab numbers were impacted in a big way by demonetization. Was it a similar case with your diagnostic business as well?
Yeah, there is a little bit of an impact. We're pleased with the revenue growth. Revenue growth was almost 11%. Our income was over 20%, slightly off from last year. There's an impact. I think that happened to everybody everywhere. It's interesting when you look at demonetization. There's certain parts of the country, I think that's one of the things we probably need to understand is that if you look at a place like the north, we have 3 hospitals, Mohali and Amritsar and Ludhiana. Then you compare to areas like Bombay and Bangalore, there's a difference. There's a difference, and the south and west have been impacted less. The north has been impacted more. So I think it's no different in diagnostics. I think the same thing has happened there. I think there's just is an adjustment component here. At the end of the day, SRL is the most respected diagnostic provider in the country. You saw the same numbers that I did last week, where Lal Path, they did take a bit of a hit. We took a slight hit as well. I don't think quite as much, but I think it's going to recover just like anything else going forward.
Right. In terms of the big restructuring that the company had proposed to demerge their businesses, can you just tell us what's the progress? When is the new listed entity expected to list?
Yes, the demerger that we announced 3 or 4 months ago, very much on track. We are, there are multiple approvals required, as you can imagine. If you're going to demerge a company and with all the regulatory compliance checks you have to do, well, we're going through that and very much on track. We believe that the demerger should be complete sometime around August, September maybe. But I think again, as I said, on track. And this is about unlocking shareholder value. And I think that this is something that we talked about that is good for SRL and the management team and their ability to run an independent business, but it's also good for the shareholders. So on track, and I don't think there's going to be anything that'll change.